Welcome back, guys. My name is Dr. Lane Tran at Fastlane Sports Therapy, and today we are going over the structures in the knee that can be injured in climbers when performing a heel hook. So we're going to dive right into it. So some structures that can be damaged are, you have essentially two categories. You have dynamic stabilizers and passive stabilizers. Dynamic stabilizers are essentially your muscles and tendons, things that you have to consciously think of to contract to add stability to the knee. So your dynamic stabilizers in the back of the thigh here, these hamstring muscles, is one, the biceps femoris, you have a long and short head, the semibratendinosus, and the semimembranosus. So these three muscles right here make up your hamstrings. And they go ahead and they attach to tendons down here that attach muscles to bone, and these tendons cross the knee joint. So when these muscles contract, what you can see here is it causes knee flexion. So just like when you're doing a heel hook, when you're bringing that heel towards the body, or you're bringing the body towards the heel, this back here is what's causing the knee to flex. So how these injuries occur usually is when an athlete doesn't load the hamstrings properly. So they've been in quarantine for 3 months. They haven't been stressing the hamstrings. They haven't been stressing the tendons. So these structures are essentially deconditioned. These structures are easily damaged when you go back into working out. So if you've taken 3 months to essentially be sedentary and you haven't been working out and you go back into the gym and you say, I'm going to go lift as heavy as I can, or I'm going to go climb as heavy as I can, I'm going to go do a heel hook as hard as I can, these structures may be damaged because the intensity, the load, the volume, the frequency at what we load tissue is how they strengthen over time. So if these hamstrings and tendons have been strengthened over time in 3 months, and we're going back into the gym and doing a heel hook as hard as we can, we're most likely going to injure these structures. So that right there is a quick gist of tendons that can be injured in an athlete when performing a heel hook.